We're about to get started, folks. Okay. Sorry, just need 1 minute. Yeah, I'm. Just 1 second. All right, we're going to get started. So good afternoon, everyone, and thank you so much for joining us today. My name is Kalela Perot, and I will be your moderator. Here to announce initial government action on the mental health recommendations from the Mass Casualty Commission, we have in person Brian Comer, Minister responsible for the Office of Addictions and Mental Health, and virtually we have Carolyn Bennett, Federal Minister of Health and Addictions and Associate Minister of Health. Minister Comer and Minister Bennett will both start with some few remarks, and then we will go to media for questions. We are going to start in the room with questions, and then we will go to the Zoom. And reporters who have registered with questions on Zoom will call upon you when it's your turn. We'll do one question with one follow-up, and then we'll go back around if time permits. Minister Comer, would you like to get started?
Sure, thanks, Kalela. Good afternoon, and thanks for joining us today. Thank you, everyone, for being here. The tragic events that unfolded in this province 3 years ago have had lasting impacts on so many Nova Scotians. None more so than the families and the victims and the communities that they call home. For those communities in Cumberland, Colchester, and Hants, the impact has been significant. We heard loud and clear the need for community-based supports during the Mass Casualty Commission hearings. We read it in their final report. We heard from the families of the victims and from the members of the broader community who told the Commission that they needed in the days, weeks, months, and years after this tragedy is support. The need for grief counseling. They need access to clinical mental health care. They needed a place to go and help charting a path through the trauma and grief that they're all experiencing, that they're all still experiencing. And while there were supports available to the families of the victims and within the broader community, we know that those supports did not meet their needs. One of the Commission's recommendations was a call to action to the province and to our partners in the federal government to jointly fund a program to address the unmet need for mental health, grief, and bereavement supports. A program designed with communities, for communities. And today I'm pleased to announce an $18 million commitment to action on behalf of both the provincial and federal governments to deliver on this recommendation. The Government of Nova Scotia is investing $9 million over the next 2 years to expand mental health and grief services in Cumberland, Colchester, and Hants counties, and to work with communities to design and deliver services and supports for the immediate and long term for these communities. The Government of Canada has also come to the table with an initial $9 million investment over 2 years as well. The Commission's recommendation spoke to the urgent need for on-the-ground supports right now in the impacted communities. Starting May 1st, there will be new mental health outreach staff based in Truro. Outreach workers will meet people in their communities. They provide mental wellness supports to individuals and groups, and they connect people to other resources, including clinical mental health care, when it's needed the most. We are also putting a mobile unit in the area starting next week. This unit will be staffed by clinical teams that offer a range of health and wellness services that will be on the site, also including mental wellness and grief supports. We're starting with Saturdays during the month of May, and we'll be expanding the service from there. On Saturday, May 6th, the mobile team will be at the Bass River Fire Hall. You don't need an appointment, just show up with your health card. A second team will be focused on community engagement and will be on site within these impacted communities with mobile units during the month of May to hear from people directly about how we can best meet their unique needs. Community members can meet with that team starting May 6th as well. We will release a full schedule for the mobile unit as they are identified. This is just the beginning. We'll be expanding these services to more people in more communities. We're also hiring more resources in the impacted communities. Recruitment has already started for clinical and frontline staff who will deliver community-based care within these communities. This includes a clinical grief lead who will provide expertise for the Northern Zone in grief and bereavement services at both the community level and across the healthcare system. We're also hiring grief and bereavement specialists, mental health clinicians, nurse practitioners, outreach workers, navigators, community engagement specialists, and more. The Commission's recommendations included needs both for the short and long term for services and supports, an approach designed with community, for community. That work will begin immediately through the Mobile Units Engagement Team. The priority over the next days, months, and years ahead will be with the community. Dates, times, and locations for consultation will be made public as they're booked. The Commission recommended that the program be developed and implemented by a local team. Discussions are already underway with our partners at Nova Scotia Health, IWK, Digicamic, and both levels of government on implementation, and there'll be more details to share with this within the next 10 days. We know that we need to move quickly on this, and we're committed to doing that, but we also know that we need to get this right. We're not taking a one-size-fits-all approach, because the needs in Portapique are going to be different than the needs in Debert or Truro or Wentworth. And so the supports in those communities are going to look different too. That's the commitment that we're making today, putting immediate mental health and grief supports on the ground in these communities, starting community consultation to shape the services both for the short and long term, recruiting clinical staff for urgent and priority needs, and bringing together local partners to help pull this all together for the long term. This plan addresses one of the Commission's recommendations. There are many others, and work is well underway now across government, including appointing an implementation committee to move them forward. We are starting here today with an $18 million commitment to action on mental health and grief services for communities. We will have more details to share in the weeks and months ahead, and I will also be traveling myself to the impacted communities in the coming weeks. We'll also be sharing details on how people can access services and participate in the consultations in a variety of different ways, including working with community-based organizations, a website, social media, and advertisements as they all are rolled out. In the meantime, any community members looking for assistance or how to access consultation can call 211. Thank you.
Thank you, Minister Comer. Okay, now we will go virtually to Minister Bennett with a few remarks.
Thank you. Thank you, everyone. Merci tout le monde. Quoi. I first want to acknowledge that I am joining you from my home today on the traditional territory of the Mississaugas of the Credit, where we pay tribute to all the Indigenous peoples who paddled these waters and whose moccasins walked these lands. I want to thank Minister Comer for hosting us today on Mi'kma'ki and for his eloquent expression of empathy for all those affected by the terrible tragedy of 3 years ago. We too grieve for those lives lost, and our hearts are with those whose lives have been forever changed. Even though I can't be with you there in person, I want to express my gratitude for my Nova Scotia colleagues who were for everything they have done for Nova Scotians, especially during these truly difficult times. Même si je ne peux pas être là avec vous, je suis reconnaissant à mes collègues de Nouvelle-Écosse pour tout ce qu'ils ont fait pour les néo-Écossais et surtout en ces temps vraiment difficiles. All Canadians acknowledge how much the tragedy has impacted you and your communities. And I thank MP Darren Fisher for joining us there with you today. And today, of course, we acknowledge Minister Fraser, who has been directly impacted by this tragedy and has been meeting with the families involved in this issue and being there since the beginning. I know that he would very much have liked to have joined us here today and with you. Aujourd'hui, nous rendons hommage au ministre Fraser, qui a été directement touché par cette tragédie et qui a rencontré les familles, s'est impliqué dans ce dossier et a été présent depuis le début. Je sais qu'il aurait aimé se joindre à nous aujourd'hui. 3 years ago, 22 people were killed across Nova Scotia, friends, neighbors. There's not a family across Nova Scotia who hasn't been impacted by this terrible tragedy. In my time as Canada's Minister of Mental Health and Addictions, I had the opportunity to meet with the Mayor of Colchester, Mayor Blair, and hear the pain of her community. We discussed the needs of the community, the need for on-the-ground support, and the need for mental health supports. En tant que ministre fédéral de la Santé mentale et des dépendances, j'ai eu l'occasion de rencontrer le maire de Colchester, Madame Blair, avec qui j'ai discuté des besoins de la communauté, de la nécessité d'un soutien sur le terrain et de la nécessité d'un soutien en matière de santé mentale. These concerns were raised quite clearly as well in the Mass Casualty Commission's final report. Right now, we are coming together to take the much needed action. The public is demanding change, and for very good reason. It is clear there were failures. Nous sommes en train de nous rassembler pour prendre les mesures nécessaires. Le public exige des changements, et ce pour de très bonnes raisons. Il est clair qu'il y a eu des échecs. We are very grateful to the Mass Casualty Commissioners and their report, which put forward concrete solutions so that the communities right here in Nova Scotia and across Canada will be safer going forward and be able to heal. Our government is committed to providing a strong federal response to the recommendations of the Mass Casualty Commission and address the unmet need for mental health, grief, and bereavement supports for the people of Nova Scotia. Notre gouvernement s'est engagé à apporter une réponse fédérale forte aux recommandations de la Commission sur les pertes massives et à répondre aux besoins non satisfaits de la population de Nouvelle-Écosse en matière de santé mentale et de soutien aux personnes en deuil. The journey ahead will not be without its challenges, but it will emphasize the importance of communities, equity, and social determinants of mental health. The Commission has, despite an incredibly difficult subject, come up with some very important recommendations. We will support Nova Scotia in enhancing its mental health capacity, including through its mental health and addiction program, and will continue to work with partners to ensure that appropriate mental health supports are available in the communities. Nous aiderons la Nouvelle-Écosse à renforcer ses capacités en matière de santé mentale, notamment par le biais de son programme de santé mentale et de lutte contre les dépendances. Et nous continuerons à travailler avec nos partenaires pour veiller à ce que les communautés disposent de services de soutien appropriés en matière de santé mentale. We also recognize that the mental health impacts of trauma can be long-lasting and welcome the Mass Casualty Commission's emphasis on mental health as a critical element of its report. Further to that investment, as Minister Comer stated, the federal government will be providing an initial $9 million over 2 years in support of the unmet mental health needs, grief, and bereavement supports for the community. En plus de cet investissement, comme l'a déclaré le ministre Comer, le gouvernement fédéral fournira un premier montant de 9 millions de dollars sur 2 ans pour répondre aux besoins non satisfaits en matière de santé mentale, de soutien aux personnes en deuil et de soutien à la communauté. With this funding, our government will contribute to Nova Scotia's grief and bereavement support model, work with the existing community-led organizations to enhance supports for affected populations, and enhance the training and resources for local area workers who are responding directly to the issues of grief, bereavement, and trauma. Also, as outlined in Budget 2023, the Government of Canada will provide the province of Manitoba with funding to support health and well-being through its tailored bilateral agreement, including a focus on efforts to improve access to timely, equitable, and quality mental health, substance use, and addiction services. We are committed to addressing the recommendations in the Mass Casualty Report and will continue identifying opportunities to further meet the needs of those affected by this tragedy. Nous sommes déterminés à donner suite aux recommandations du rapport sur les accidents de masse et nous continuerons à identifier les possibilités de mieux répondre aux besoins des personnes touchées par cette tragédie. We again want to thank the Commission for this important work and reiterate our commitment to the entire community of Nova Scotia. Our hearts remain with the families and your communities. Your tragedy will never be forgotten. We are truly grateful to the families for your participation in the process. We know that was extremely difficult, but your courage in helping inform the recommendations is going to protect other communities and your community going forward. We know that your contributions will help other families and communities from experiencing the terrible pain and loss that you have suffered. Nous savons que vos contributions permettront d'éviter à d'autres familles et communautés de connaître la terrible douleur et la perte que vous avez subie. Thank you. Merci beaucoup. Will Allen.
Thank you, Minister Bennett. We will now move to the room for questions from media.
Given how difficult it is to recruit healthcare workers at the best of times, and particularly in rural areas, how realistic is it to expect to be able to fill these positions for Cumberland and Colchester County in the foreseeable future?
Yeah, so one of the positions is already filled. That starts Monday. That'll be a mental health clinician that will be based in the community as a community liaison connection point. As we also mentioned, there'll be collaborative care teams that will be deployed there next week, which will consist both of primary healthcare, mental health care clinicians. Recruitment to rural regions in the province, certainly a challenge. There will be certainly a focus with the Office of Healthcare Professionals Recruitment focusing on the northern zone specifically. I've been to that zone a number of times myself to meet with the clinical team. They're very dedicated to this work. I certainly think there's a lot of positive momentum there lately with the mental health clinician aspect. But the rural part of the province, certainly some challenges, and we're dedicated to meeting those challenges.
18 million for 2 years. What about on a go-forward basis beyond that? Because in this report you indicate that there's going to be assessments up to the year 2028.
Yeah, so the needs assessments and impact assessments in 23, 25, and 28. The first one will begin immediately. So this is a 2-year funding agreement with our federal colleagues, which is a significant amount both for the immediate and long term. So sort of we engage with our community partners. A lot of where things are going to be heading in the future is heavily reliant on what the community needs and wants. So certainly be more to come with that in the future.
How are you going to ensure long-term follow-up? I mean, this was one of the things that didn't happen. People had trouble accessing long-term care. No one was checking on people. How do you ensure that?
Yeah, I certainly think in the days and weeks and months after the tragedy happened, there was certainly a lot of work on the ground that did occur. But I think we heard very clearly from the reports that wasn't enough, and we certainly accept that responsibility here today. So certainly these immediate actions that we're taking as a provincial and federal government are a first step of many. With the long-term goal with empowering these community organizations, they'll play a key part as we move forward.
I have a question for Minister Bennett. One of the recommendations, I don't know if you can hear me, but one of the recommendations is that the federal government should subsidize the cost of mental health services at a minimum proportion equal to the proportion to which it subsidizes RCMP policing services. So you're talking about the importance of mental health services today. Like, is the federal government going to increase its funding? Is this something you can commit to?
Well, as you know, in Budget 2023 and the announcement that was made February 7th by the Prime Minister that over the next 10 years, Nova Scotia will receive $4.8 billion in funding, additional funding, and $1 billion is in that action plan with the bilateral agreement with Nova Scotia. One of the 4 pillars there is mental health and substance use, and as you know, the other pillars are attachment to a primary care team. The other is support to assist with preventing burnout, to assist in recruitment and retention. And then the other part is the 4th pillar is with using the technology and the tools to be able to have a modern, accountable system as we go forward in terms of sharing data. I think it is really important that we recognize that even the mental health workforce now looks very different. That people with lived experience are doing extraordinarily important work, that there is a way of supporting community in a way that communities design and deliver. And I just wanted to give a shout out to what is happening with Strongest Families in the kind of work they're doing with people trained up to be able to answer the calls 24/7 in both official languages, but also what is now available with Wellness Together Canada, where we want to know that we are there for people and that they aren't alone.
Thank you. And my follow-up for Minister Comer, given the fact that it's taken 3 years to have one outreach staff and a mobile health clinic, what are you going to tell Nova Scotians who are nervous maybe that the next time there's a tragedy, they won't get the help they need because it's taken 3 years to respond to this one?
Yeah, I would certainly say that the administration previous to us and we formed government, I think in the early days after the tragedy, there was a lot of efforts concerted in that community to provide services. I would say we heard very clearly that it wasn't sufficient to meet the needs of the communities. So I think certainly today as we lay out the future path for the short, the medium and long term for this part of the province, we're committing to that today, and certainly we'll continue that work.
On that, given what we heard from the people in Portapique, obviously it's been a problem for a while getting this support. Why couldn't this initiative have started sooner? Did you feel like you had to wait for the final report of the commission before you could embark upon this?
Yeah, I would say as a government, I know as a deputy ministers of various departments have been working very hard for a number of months to do work there already on the ground. It was difficult in the sense we couldn't presuppose the recommendations before we saw them. Certainly, now that we have seen the recommendations and have made this commitment today, we're very committed to doing that work.
Follow-up question to that. Why do you have to wait for the recommendations? I mean, media covered that this was an issue. Residents were saying this was an issue. Why didn't you just take initiative?
Yeah, there was certainly a lot of work done there on the ground in the previous months, significant pieces of work, both from clinical services and also from community-based organizations. Today is an enhancement to those efforts, both for the immediate term and for the long term.
When would you intend to roll out similar services to the rest of the province, and how much might that cost?
As I've stated previously, we're certainly dedicated to the needs assessment and engaging with our community partners. Today's announcement is for a 2-year time frame. Those needs assessments will begin immediately, so we'll have to wait to have a thorough dialogue from the community, who are key partners with this, before we kind of make those sort of specific statements.
Or without a full team all ready to go, obviously May 1st you've got one staff member ready to roll, but that's obviously not going to be able to meet the needs on their own. How confident are you that people will get their needs met in a reasonable amount of time? Do you have a commitment in terms of when people can access service, I guess?
Yeah, so the one position that you referred to starts Monday, but there's also a commitment today to have the mobile primary care clinics, which will also have mental health clinicians as part of those teams. They'll also be rolled out next week. The other position stated, the grief subject matter expert who will oversee the Northern Zone strategic direction, will be expedited, and there'll be a lot of focus within my office to get that position filled immediately. So there will be help there immediately, and that help will be ongoing.
We're trying to get the answer from your staff, but I guess, do you have any target in terms of how many people we need, understanding that obviously the needs are different, as you alluded to? I certainly understand that, but do you have a ballpark in terms of how many people? Are we talking 30 people to cover this, or are we talking 200?
Yeah, in terms of specific human resources questions, I would suggest that this will be a very important part of the community consultations with both community-based organizations and actual individuals that live in the community. One thing I've learned of being a clinician in my previous life is that the significant traumas people can want to access care in very different ways, right? So this will be a key piece to that consultation, so there'll be more to say with that in the coming days.
All right, with that, we're going to move to the video conference virtually, questions media. To start, we will go to Michael McDonald with the Canadian Press. Do you have any questions?
Yes, Minister Comer. The Nova Scotia government was told 3 years ago that the program you're announcing today is exactly what was needed back then. Why did the government ignore that call back then?
Yeah, I certainly can't speak to that recommendation at the time. Certainly, I know that the team has been working very hard in the weeks and days and months, that happened after the tragedy occurred. What I can speak to today is the $18 million commitment, and immediate help and long-term commitment to the people of those impacted communities.
And do you have a follow-up, Michael?
The province was presented with a provincial grief strategy that probably would have helped a lot of people deal with what happened in Port Pick and elsewhere. Why was that strategy shelved?
Yes, I certainly, I'm not aware of the shelving of that specific strategy. I know there's a very dedicated team within the northern region and with our Nova Scotia Health team as a provincial body that have very dedicated clinicians and experts in this field. And as I stated previously, there will be a dedicated individual with expertise in this field to oversee this commitment. I'm looking forward to getting that position filled as quickly as possible.
Thank you. Next, we will move along to Lindsay Jones with the Globe and Mail. Lindsay, go ahead.
Hi, Minister Comer. My question is around the need for more consultation. This is something that many people in the community would say is not something that they necessarily require. Why do we need more consultation at this stage, especially as Michael McDonald just mentioned, there was this grief strategy that was shelved some time ago?
Yeah, I would say speaking to members that were impacted in the community, speaking with my colleague Tom Taggart, who represents the community and talks to these families daily, I would say there's a varied approach for how people want to access services. Some people feel like they still have valuable knowledge that they can contribute to how the healthcare services will be delivered in the future, and other individuals don't want to consult any further, which is completely understandable given the scope of the trauma that they have endured. So I certainly think how the short and long-term strategy is focused certainly values that community input.
Do you have a follow-up, Lindsay?
Sure. Yeah. I guess my other question is, I've been hearing from community leaders on the ground about the need for mental health services, that there is an increase in the amount of family violence in the area as a result of the mass casualty. What do you have to say to the people who've been suffering without these supports for 3 years?
I would say that's the impacts in the community have been devastating, for certain. I would say today's commitment, offers immediate supports and a long-term strategic path to work alongside communities and supporting them.
Thank you. Next, we have Jake Boudreau with The Advocate. Jake, go ahead.
Is there a concern, just for Minister Comer, that because 3 years have lapsed, that these extra people that are going to be brought in have an extra burden that they have to make up for lost time?
Yeah, I certainly think that I think we have some of the best clinicians in the country in terms of delivering trauma-informed care to communities. Certainly with today's announcement, I do think it's very clear that they have provincial and federal support for carrying out these initiatives. Certainly the community-based organizations, they are very important pieces to this strategy moving forward. So we'll be there to support them every step along the way.
And do you have a follow-up, Jake?
Is there going to be any leeway provided to these people that are now going to be on the ground as far as being able to fulfill their duties, knowing that has been 3 years since it passed, and there's a lot of problems that have accumulated over time?
Yeah, certainly, mental health needs and grief and trauma can be very complex and very unique based on the needs of the individuals and the communities. So I think there's significant increase in support both for the immediate and long term. I'm very hopeful that working with our community partners that we can provide the help that is needed for them.
Thank you. And we have time to go around once more with one question for each reporter. Michael McDonald, do you have another question?
Yeah, sorry, I was just eating grapes. Terrible. I didn't know I did that. I just wanted to be clear about one thing, and I apologize for this. The mobile, I think it's a mobile mental health team. I'm not sure if that's the right phrase, but this will, the staffing for that will come from existing positions within the health system, correct? You're not hiring anyone for that.
So I would say there's three different pieces to that. There's the community liaison clinician that will start Monday. There's the primary mobile care clinics, which would be staff already employed within the health authority that will be working outside of their typical hours. And there'll also be a mobile community consultation team that wouldn't be healthcare clinicians necessarily, but would be a valuable piece of gathering feedback from the community.
Thank you. And Lindsay, do you have another question?
I'm fine, thanks.
Thanks. And Jake, do you have another question?
No, I do not.
Thank you. With that, we'll go back to the room. We have a few more minutes for questions.
Minister, I wonder if you can just help me understand how you came up with the $18 million figure when you haven't done the community consultations yet. How do you know it's $18 million and not more or less?
Yeah, I would say from a provincial standpoint, we've done a significant piece of work towards universal mental health care thus far. A significant portion of those priorities were with grief, bereavement, access to mild to moderate care for Nova Scotians. So a lot of that work was already underway. As we kind of chart a path forward with the community, I'm sure the information can change, but today shows a significant commitment, I think, for the next 2 years.
Minister Comer, I've got a two-part question, I guess. How do you ensure that you can reach all these, right? It's such a wide-ranging geographic area. How do you ensure you can reach everyone in need, and what does success look like from today moving forward?
Yeah, I think in rural parts of the province and certainly rural parts of the country, certainly access to care is a significant issue. I think having the mobile options for a variety of ways, to get that care is important for sure. And I think it's also important that we engage with our community partners to ensure that we're kind of offering care in a variety of ways. Because something we do know is that people can often access mental health care in a variety of different ways, based on stigma, based on their comfortability with sort of accessing services.
And what does success look like? What if you look down the road 2 years from now? How would you judge this program, this announcement on its success?
Yeah, I certainly think working with the community, having a collaborative dialogue that's continuous. I know talking to the leadership in the community with MLA Taggart and Mayor Blair, who I've met with also, and certainly the needs assessments and the collective impact assessments will provide some more quantitative data to understand the impact. But we have to hear from the community impact it more than anything else, for sure.
Is there more funding do you expect in 2 years? So this funding's for 2. Is there more funding do you suspect to be here again doing the same type of thing?
I wouldn't presuppose that today before we do the assessments and engagement with the community. I would certainly say today is an $18 million commitment to show a commitment by the provincial and federal government that we're going to be here to support these communities.
No more questions in the room? Okay, with that, thank you so much for joining us today. That concludes today's announcement.
Thank you.